In this video, we will be describing the buccal aspect of permanent maxillary first molar. The permanent maxillary first molar is roughly trapezoidal with the cervical and the occlusal surface representing the parallel lines and the mesial and the distal outlines representing the non-parallel lines of the trapezoid. When you look at the tooth from the buccal aspect, you can appreciate the two buccal cusps, the mesiobuccal cusp and the distobuccal cusp. Not only that, you can also see the tip of the mesiopalatal as well as you can see the tip of the distopalatal cusp. This is because the tooth is oriented in such a way that the buccal groove is perpendicular to the plane. And when you see the tooth from the occlusal aspect, you can appreciate that the buccal surface and the distal surface, they form an obtuse angle. Since this angle is obtuse, more of the distal surface is seen from the buccal aspect. So when you position the tooth in such a way, you can actually see a lot of the distal portion of the tooth. And the buccal groove is roughly a midpoint between the mesiobuccal line angle and the distolingual line angle. So when you position the tooth like this, you have two surfaces and buccal groove is midline between the mesiobuccal and the distolingual line angles. The buccal groove is roughly parallel to the direction of the distobuccal root. The buccal groove ends somewhere in the middle of the crown, and at the point of ending of this particular groove, you will see a developmental depression in a mesiodistal direction. This may not be appreciated from the buccal aspect, but when you tilt the tooth to the distal aspect, you can actually appreciate a depression or a concavity that you see in this particular area. The mesial outline of this tooth is straight from the cervical portion till the contact area. The contact point is 2/3 the cervico-occlusal width, so at the junction of middle and the occlusal third. The distal outline, on the other hand, is rounded and the contact point is at the middle of the middle third. Let's describe the cusps. The mesiobuccal cusp is the wider of the two. The mesiobuccal cusp has two slopes. The distal slope and the mesial slope meet at an obtuse angle. The mesial slope and distal slope of the distobuccal cusp meet at 90 degrees, making this cusp a little more sharper. The cervical line is prominent. It doesn't form a typical curve. However, it may sometimes dip towards the cervical portion. Let us describe the root on a tooth specimen. When you look at this tooth from the buccal aspect, you can appreciate all the three roots. You can appreciate the mesiobuccal, distobuccal, as well as the palatal root can be seen between the two. The mesiobuccal root is straight and it forms a 90 degree with the cervical line. The distobuccal root, on the other hand, is more mesially oriented, making an acute angle at the junction of the cervical line. There is a bifurcation that you note, which is roughly 4 millimeters. However, it varies, but it is much more apical than that of a deciduous teeth. The deciduous teeth shows bifurcation very close to the cervical line. At no point of time, the widest dimension of the roots is wider than the crown. It is always within the confines. And the level of the root, which shows no bifurcation, is called as the root trunk. This is the base of the root from which the three roots develop. You also find a developmental depression from the bifurcation till the cervical line. The mesiobuccal root is straight and it tilts distally at the middle third. The distobuccal root also goes little more towards the center and it tends to tilt mesially in most of the specimens. In this particular specimen, from the middle third, it is going in a distal direction. These are the salient features from the buccal aspect.